Volux XC is the first and only HA dermal filler FDA approved to create lasting definition in the jawline. The look of a snatched jaw is unmatched by any other facial treatment. Love your look from every angle and realize how much power your profile holds. Designed to define. Juvederm Volux XC.
Hi. So today I want to talk just a little bit more about the lower face. We've talked about some other things like the mid face, and we've talked about M face, but lower face has gotten a lot of press, both in the media and on social media platforms. And so why is that? Apparently 70% of consumers are very much bothered by their jowls or the lower face, and 30% of patients are bothered by their weak or their narrow jawline. Additionally, the searches on Google have gone up by 10 times, tenfold in the last 5 years. And just this year alone, there has been 2 million searches regarding the jawline on Google. 40% of consumers are considering treating their jawline, but they want to know how to treat their jawline. They don't know what to look for in a technology. The jawline is so important when it comes to facial traits and addressing the attractiveness of the facial traits. It really distinguishes the masculinity or the femininity of a person. Whether we realize it or not, we look at that jawline to distinguish that characteristic, and it can really define that feature for us in the blink of an eye. The jawline can create facial balance, and it frames the face for us. So how do we do this? How do we achieve this facial strength and this jawline that gives a contour? It gives a sharp angle, but achieves a contoured effect, and it doesn't cause any kind of masculinity in a female or a female characteristic in a male patient. We want a well-contoured jawline that's desirable in all genders. So enter the newest filler in the Juvederm portfolio from the Allergan family, Volux. So as the patient ages, we begin to lose definition, as we've talked about, in the mid-face, but that also affects our jawline, and we start to see laxity in the lower face and jowling. So I have this model, and of course she has a perfect jawline, but you can see here, if we lose volume in the mid-face, then we'll start to lose this jawline, this nice contour and this angle of the jaw. And so if I have a patient that comes to me and they give me what I term this kind of 3-finger salute, they say, but I would look so much better if my face were lifted here, but they're not ready to embark on that surgical journey, then Volux and Voluma may be a good plan for this patient. So if you can create a lift in the mid face and it creates a contour in this lower face, then we can start first, of course, in the mid face as we've discussed, and then we can also move into this jawline area and create a contour in the lower face as well. So these two fillers are sort of like peanut butter and jelly. We can create a contour first in the mid face by lifting, and we can create a contour in the jawline with Volux. So Volux was designed to also be used with a cannula to inject along the jawline here by placing it deep onto the bone to create that lifting effect. So it's a much more robust product than Voluma. In the past, when we haven't had a filler that has met our needs, we oftentimes have used some other products. So some of our patients have actually used Voluma until now we have had the release of Volux. So as an AMI trainer, I have had the fortunate opportunity to be able to train on Volux. And so now we're going to be offering that to our patients first, and we're going to be giving that to our patients and using it along this jawline here before it officially launches in January to the rest of the nation. So where are we going to be placing this product? Let's look. Everywhere you see this teal kind of green color, these are the FDA indicated areas for Volux. So you can see you can actually extend it all along the jawline. These are the FDA indicated areas. So all the way down to the chin region. So each patient, of course, is different and unique. And so we need to customize it according to that patient's needs. So some patients, even who are young millennials, will want to use this product to reshape or to change their face, depending again on masculinity needs, femininity needs. You know, even the older patient who is starting to see that jowling, that sagging that we were talking about, we may want to start again in the mid face because they're having aging issues, and then move into that lower face to achieve the lift that they're looking for. And then the purple area that we're seeing here in the chin, that would be an area that we would utilize Voluma. Very nice product. So here we're seeing the differences between the male and the female angle of the jaw. So there are differences. And again, this product will be unique in that we can use it in all ages. Again, we're seeing a lot of different platforms across social media and various channels that say this is something that people want. They want to see these kinds of aesthetic procedures regardless of whether they're male or female, because it can be very enhancing aesthetically. So again, these are the areas where we can inject safely and that are FDA approved with our newest Volux product. It is a hyaluronic acid. It's quite a robust product, so there will be some swelling immediately after the product is placed and for the next 2 to 3 days. This is normal. This is very normal, and patients will be told that they will want to eat, you know, things like soup and, you know, softer foods. So no steak, no burgers, nothing like that, and no dental work for at least 2 weeks following the procedure. So very robust product, but one that gives extreme lifting in this area. All right, so some really good before and after pictures. So a younger gentleman, age 30, and you can see how well defined before and then after. We're getting some really great results here, and then on his oblique angle as well. How nice and structured that jawline just comes out here. So really nice result in his lower face. Okay, he did not have any Voluma injected, so just Volux. Let's look at another patient. All right, so this patient, a little bit different, also very young, only 30 years old, but she did have Voluma placed in her mid-face for more contouring. And then she also had some Voluma placed in her chin, 2 syringes, and she also had 6 cc's or 6 syringes of Volux placed in her jawline. And she had an excellent result. Part of her problem was the fact that, she did have a little bit of a chin that was not in alignment with her nose and her forehead. So this was brought forward here. And that's one of the things that you can do is structurally you can change the face shape or the jaw angle using this product. So they made her chin a little more heart-shaped, overall changing the facial shape and the contour of her face. All right, so this gentleman, he's 35 and he had 2 cc's of Voluma placed in his chin, and then he had 5 syringes of Volux placed in his jawline. And depending on how much product the patient needs to have injected, it will likely be staged. So typically this product is robust enough that if you say require more than 4 syringes at any one sitting, most likely it will be staged into 2 separate sessions. And then one final patient. This was a 54-year-old, and she had also Voluma placed in her mid-face as well as Volux placed in her jawline. And she actually had 7 syringes. So she went from what we would classify as more of a W jawline. That's what we call it when you're starting to get that joweling effect. So it's not a smooth, contoured jawline before, but now after, you're starting to see that nice contour. Very long-lasting product because of the fact that it is very similar to bone, and so it's going to have a much longer lasting life. It's approved by the FDA for up to a year, but the life is actually going to be much longer than that, according to our colleagues in Europe and Canada. So Volux, very exciting that we have a high hyaluronic acid product now that is FDA approved to be utilized on the jawline. We're very encouraged by this, and I'm looking forward to using this because this adds such a great tool to our arsenal now that we have a jawline filler to frame the face. And now we can think of this in combination with things like Voluma or M-Face or even Kybella. So we've been utilizing Kybella now to treat the submental fat region, and also off-label we've used it in the jowls to treat the fat pads here. But now we can combine that to achieve a very taut, snatch jawline, so to speak. And so we can combine a lot of these procedures and products to give the patient that look that they are trying to achieve, to make that patient achieve the age that they are going for. We want to give the patient the best life that they would like to live. Patients are wanting less invasive procedures. They want to look as good as they feel. And this is one more arsenal in our toolbox that we can offer them. So hopefully you'll join me in celebrating this newest HA filler, Volux, and we will be able to embark on this journey together.
A lot of patients, female patients, at least in my practice, is that they want the jaw a little bit, but they don't want to look masculine. And what's amazing about Volux is you can give them that crisp definition and be so precise without overwhelming the lower face and giving them that boxy look that they're afraid of. And that applies to using the chin as well. So here's what I wanted you to see. This is what we're trying to do under the skin, and you can see this product. I mean, imagine that subcutaneous, it stays like that, and you get that lift, and it's so cohesive that it really does achieve the goal. And you can see non-dominant hand at the back, really making sure that, okay, that's where I want to stop. A tongue depressor works great for a learner as well. If you put it underneath the mandible and they use that and pinch between to help keep that product where we want it to go. I'm pinching there. I do a lot of pinching, but I was trying to keep the hand out of the way so I wasn't blocking the camera. I'm underneath here. Continue on with cannula. And same thing, I've got Voluma here. So in photos, I like to have them in their pre-photos, smile big with teeth. And I like to have them do a kiss because that engages, right, all of the muscles through the modiolus and the lower